hair transplant surgery is surgery, okay? So it means it has to be a doctor. It is surgery. However, it is a special type of surgery where you keep repeating the same surgical maneuvers and thousands of times. Now, that doesn't exist in any other surgery, including the cosmetic surgeries we do, like nose surgery, breast surgery. You do a different maneuver every second of your service or your surgery, and you finish it. It's like drawing a painting where none of the parts of the painting are symmetrical or same. So it's an individual performance where there's no repetition. Whereas hair transplant surgeries, you just take, dig a hole, put it in. Take, dig a hole, and you do that thousands and sometimes tens of thousands of times. So that's why there are parts of this procedure which are technically heavy rather than artistically heavy. So there's no judgment being made. You're just repeating a maneuver that you have mastered or you should have mastered, okay? And you're doing it so many times that it adds up to a very, very labor-intensive and long procedure. So that's why in this type of surgeries, it is possible to license other medical staff. In the United States, there are so-called nurse practitioners and physician assistants who are trained, licensed to do some parts of surgery. And I was surprised even to hear that a nurse practitioner in the United States, some states, could do the surgery even without the surgeon being in the facility. So it can go up to that level, you know, because of the nature of the procedure. But even in, you know, critically important surgeries like transplanting other tissues, organs, in the Far East, there are trained anastomosis technicians that come in and tie the blood vessels together, you know, so the organ gets the blood circulation. Because they're trained only to do that, they're even able to do it better than the doctor himself. So the doctor steps back, the technician does the vessels, and he comes back and continues the surgery. So it shows that parts of surgery could be delegated to people who are especially trained to keep doing the same thing, which doesn't require special judgment, and it's just a repetition. And hair transplant is probably on the top of that, because as I said, it's repeating the same thing thousands of times. So hair transplant surgery becomes a team's work. So different people take parts in the surgery when it's done. However, in the world and in the countries, there are differences in the practices. Like it could be a doctor-heavy procedure, or it could be a technician-heavy procedure, depending on laws, regulations, marketing dynamics, prices, demand, and many things. So it can be practiced different ways. Now, Turkey is the center of the world for cheaper hair transplants. Now, the primary reason for that is because the laws allow for more delegation, okay? That means even the whole procedure could be done by a technician, and that's still within the regulations of the... I debate if that's a very good idea, but it's a fact. And it applies to some states, like for instance, in California, in British Columbia, the same thing applies. Technicians can do surgery under the doctor's supervision. So in some countries and states, this is both legal and there are people licensed to do it. So now Turkey is, as I said, the center for cheaper hair transplants. The primary reason is this. And the secondary reason is that all the labors are cheaper. So you have to add those two up, you know, even the equivalent labor is cheaper. Plus, it's also possible to delegate more. So the price difference is great. It's 1 to 10, 1 to 20 compared to some other countries. Okay, so, but some of those, or most of those surgeries are also not only very cheap, they're also low quality. One of the reasons is there's no training, there's no supervising doctor. It's like it's not just delegating during the surgery, everything is delegated. Like teams come in and do the surgery, even the company doesn't know who these people are, and so it can be that level. So then there's no quality control. So that means if you delegate, it doesn't mean it's perfectly safe in every way. There has to be quality control. Whereas in some surgical centers, there is doctors' involvement and also training available so that there is quality control. And my company is one of them, okay? So now, obviously, there are three parts of a hair transplant procedure. The harvesting part, now this harvesting part, donor harvesting, it could be two ways. It could be strip or it could be FUE. And there's recipient site making, so you make incisions to make the recipient site. And then there's the placement, you call that implantation. So there's a placement part, three parts. So now, depending on practicality and regulations, this could be practiced different ways. As I said, in Turkey, it could be fully delegated to technicians. But I'm one of the doctors in Turkey who prefers to be involved. Doctor-only surgery in world standards means the doctor does all the cuts, or in the medical term, incisions. So if he does all the cuts, or she, it means this is called doctor-only surgery. It doesn't mean that there's nothing done by other people. Like there's going to be, if this is in the case of a strip, there's going to be graft dissection under the microscope done by a team of technicians. So there's actually modification to the tissue, but it's outside of the body, okay? Or it could be arrangement or kind of arranging the grafts, trimming them, both in FUE and strip. These are done by the technicians. Placement, the placement does not involve an incision. It doesn't involve a cut in the human body. So it's mostly done worldwide by technicians. So, and this is called doctor-only surgery. So when we say doctor-only surgery, it means the doctor is doing whenever there is a cut and the other parts are done. So it doesn't mean that the placement is also done by the doctor. In some cases, the doctor may choose to be involved in the placement. Now I'm saying involved because if the doctor is going to do all the placement, now it's incredibly limiting. Because if in the case of a strip, it's absolutely impossible because the doctor could not take a strip, modify all the grafts and place. You'd be talking about 300 grafts per day. So the doctor could be involved in the placement. And it happens especially in the strip method because the strip is a quick harvesting method, takes half an hour to 1 hour to take it out. And so and then you do recipient sites and maybe the doctor could say, let's put some grafts. In FUE, however, that's lost its practicality because FUE incisions, that means the graft incisions, is so labor intensive that if we are talking about a doctor-only FUE procedure, that means the doctor is going to the recipient sites, he's going to spend 5 hours to take 2,000 grafts, another hour he's dead. So there's almost no practice in the world where in an FUE procedure, the doctor would take all the grafts, do all the recipient sites, and then place all the grafts as well, except a couple of doctors in the world that I know, 2 or 3 maybe, that are choosing to do 400 to 500 grafts per day and finishing one surgery in 1 week. So if I was to do 500 grafts per day, a single patient, so no involvement in any other surgery, and I took all the grafts, did the recipient sites, and placed these grafts, it would take me all day. And that means since most of the surgeries you can't get a satisfactory result by just doing 500 grafts, it would mean you're going to work 4 to 5 days on one patient to get a reasonable result. Now, is that possible? Yes, it is. But it requires a very special market. That is, we're talking about 50,000 euros invested in one surgery. And you'd need a lot of patients to do that, not just once a year. So even if you told me, doctor, I'm so wealthy that I'm going to pay you 50,000 euros to do, the problem is I still can't do it because I would need a patient, at least 1 or 2 patients a week wanting to do that so that that becomes my practice, okay? If that's a patient every 1 a year, then I have to concentrate on the other parts of the surgery, like the graft extractions or the recipient sites, and I have to leave the placement to the technicians, as in the doctor-only surgery. And now what's going to happen is I'm not going to have good skills in the placement, and my technicians who do that every day are going to do it much better than me. And now even if I want to do it on you, you're not going to benefit. You're not going to get what you paid for, because the most junior technician I have is going to do better placement than I do. So that means if I'm going to be involved, if I'm going to do the implantation, the placement myself, it would require, number 1, a patient or 2 every week wanting that and paying for that amount, which is an extreme cost. And so that I would do all those parts and be skilled in each of those parts. Since that doesn't apply, no one ever wants that, you know, then it becomes impossible to provide. It's like a tourist saying, I want to go to the moon. A normal touristic office could not offer this even if the person was willing to pay a couple of $1 million, simply because the system is not prepared to give that service. Even with money, you can't do it. So it's similar to that. So even if you put the money on the table, and I said yes, you wouldn't benefit from it because I haven't placed a single graft in the last 5 years. Or maybe I've done it for just demonstration purposes. So it doesn't, you know, apply to the practice. And as I said, the most junior technician is going to do that better than I do. So that what happens is the market and science evolve in a way to be the most cost effective. That means the least costly as possible and the most effective as possible as a result. So it evolves in that way. So if you want to part from that, it's hard. There are doctors. I could give you a name. There's a doctor in Switzerland that I know, and I don't know a second one, who takes all the FUE grafts, does the recipient sites, and finishes 1 surgery in 4 days. You know, it's possible, but you know, it's 1 out of tens of thousands of practices. You know, but it's possible. If you were to ask, I would give that, because I'm not ready to do that. My practice, it's not realistic in Turkey to charge tens of thousands of euros and do that type of surgery.